Well, let's return to our top story, and Dr. Ahmad Al-Fara joins us live from the southern Gazan city of Khan Yunis. He is the head of Maternity and Pediatrics at Nasser Hospital, one of the very few medical complexes still standing in the Gaza Strip. Really, thank you so much, Doctor, for making time for us today. Just how difficult is it, Dr. Ahmed, and difficult and dangerous to be pregnant in Gaza right now?
Okay, thank you for having me, my colleagues and my friends. We are in the most critical time that we have facing from the beginning of this war. You know, we are nearly 660 days. The last 60 days is equal 600 days if we put it in a balance. Actually, we are in the most critical and hard time that we are feeling since the beginning of this war. I will give you updating about my hospital, Nasser Medical Complex, and we will talk about maternity and pediatrics. You know, maternity or pregnant women, they are suffering too much. It is very difficult for them to be pregnant in this situation due to lack of privacy and evacuation intents. And when she's pregnant, for good luck for her, but unfortunately she will not be followed up by doctors. She will not be taking her medication like folic acid and multivitamins. She will not receiving good food or good diet. She will not receiving any vegetables or fruits. She will not be able or safe. She's under stress. All is her effort is focus on how to keep the water is clean for her babies or for her kids, or to have food for her family. So she's have one of 3 or 4 options. First option is to have miscarriage. Second option is to have a baby with congenital anomalies, which increased in Gaza in this war. Third option is to have a baby with intrauterine growth retardation, that means little baby in size. Fourth option is to have a premature baby. Fifth option is to have a stillbirth baby that is dying while delivered. You know, one of the maternity doctors told me, he's a friend to me, that he noticed that the mothers are not able to make force in labor, to make try to help the doctor to have normal delivery. So the cesarean section increased nowadays in Gaza. Also, the babies are small according to the mean average that we were using or dealing with before the war. Before the war, the mean weight is nearly 3 kilo to 3 kilo and a half. Nowadays, just 2 kilo to kilo and a half. That we lost nearly 1 kilo for every baby. This baby will suffer in the future, will suffer from respiratory problems, lack of immunity, and respiratory problems, and he will suffer in gaining weight in the problem. So it is complicated. He will be in the hospital in the few days or weeks, and
Dr. Ahmed,
he will live. Yes.
And you mentioned there are many, sadly, many options: miscarriage, premature babies, and of course, as you're saying, babies being born now a kilo less in weight than they were before the war, Israel's war on Gaza started. What help is there for these women? What do they need right now? And is anything that's come in through Israel in the past few days, through the border or from the airdrops, helping precisely the pregnant women at all?
Actually, since the beginning of March, we are suffering too much in the health sector. This is according to AIDS, according to medical supplies, according to infant formula and special formula. Nowadays, trucks are coming inside Gaza, but unfortunately, these trucks are coming in random way. They are coming in areas that it is very difficult for a citizen like me, a doctor, to go there. I'm afraid that if I went there, I will be shooted or targeted. I will lose my life. Even I can't send my son, and he is asking me, should I go, my father, there? I'll try no way to go there, because you may go there and you will not come back, and this is happening every day. This is the first thing. If the families union in Gaza or some volunteers try to protect these trucks and try to make her safe to come inside Gaza, unfortunately they are targeted by Air Force strike or air drone, and they killed. And last week Gaza lost nearly 10 persons of these groups who were trying to protect that trucks. So it is complicated. Again, we have to recognize, Israel should recognize that the only way to deal with the Palestinian people is through the United Nations, like UNRWA, like UNICEF, like OCHA, like World Kitchen. The trucks is come inside for these categories of NGOs or facilities, and then they are dealing with the Palestinian citizen, according to the civilian records. Everyone has ID number and have his phone, and send a message for him to go with humanity and feeling about the humanity, and go with respect and receive his package for his family. This is what they are doing. It's like sand in the eyes. It's nothing difference between 2 weeks ago and now, either for medical supplies, either for milk, or either for food.
Dr. Ahmad, thank you so much for speaking to us today on TRT World, and we wish you the best of luck with your work, especially your patients and as pregnant mothers and babies. Thank you, Dr. Ahmad Al-Fara.